All right, so how can you actually modify a patient's environment? Well, step one is to conduct an environmental assessment. Best practice is actually to be able to go out into the patient's own home and have a look at what they have. And you don't have to restrict that just to their home. You can go to their workplace, their school, wherever they spend much of their time to find out what their setup is like and identify potentially any hazards that are there, check to see if the lighting is good enough, what equipment or modifications they currently have, and then formulate what they want and need from there. So home visit is best. Okay, so let's start with some of the modifications that we can implement. Well, the first one is make things bigger. So essentially here you're using the principle of relative size magnification. So if you double the size of an object, the angle it subtends on the retina also doubles. And this is information that you should have picked up in the optical aids prescribing section of this subject. So for example, if your patient has difficulty reading N12 font, provide him or her with documents that are printed in, say, N24 font. So essentially you're providing 2 times magnification. This is most useful for patients with moderate vision impairment. If they need more magnification, it's going to be more difficult, obviously, to make things that much bigger. So some examples of making things bigger in the home environment are sticking large stick-on letters on a computer keyboard or on a phone, labeling food containers in a larger font, with those labelers that you can buy, providing or purchasing large print recipe books, or if patients write out their own recipes, they might want to use a nice big fat black texter and write in large print. You can also buy measuring cups with large print values to tell you how much the container actually stores, so 1 cup, half a cup, or whatever. Large print calendars are available and large print personal address books, and also recreational items like large print playing cards, for example. You're going to see a lot of these modified objects at your visit to Vision Australia, so please make use of that visit by having a look and seeing what potential things are available in terms of this making things bigger concept for your patient. Next, we're going to talk about manipulating colour. You should already know that people with vision impairment often have difficulty identifying colours, so they might struggle with, say, pink and yellow or blue, brown, black, for example, and often they'll complain that they can't see clothes hanging in a wardrobe and can't tell the difference between a blue pair of pants and a black pair of pants. They have that sort of difficulty. Sometimes also telling the difference between colours of shoes can be a problem, and occasionally a patient will report that they've put on 2 different coloured shoes, a navy pair and a black pair, because they haven't been able to tell the 2 apart, especially if the style is very much the same. So principles of colour manipulation are that you should use bright colours, which are easier to see, use lighting to increase colour visibility, and also colour is a very useful warning cue. For example, identifying the edges of steps. Sometimes if a patient has quite a lot of steps at home and they can't tell the depth, you can put a bright strip of colour on the edge of the steps so they can identify where that edge is. I had a patient once who had vision impairment as a result of macular degeneration, and of course she consequently had problems identifying colour. And one of the things that she used to do as her daily task was to pencil in her eyebrows using a brown eyebrow pencil. However, that particular day she mistook the brown pencil for her red lipstick pencil liner, and therefore shaded her eyebrows in red, and she left the house like that, and she was very embarrassed, but also grateful to be told. So if you see those kind of errors, it's useful to to let your patients know that that's what they've done. One way of helping her might be to just help her in the bathroom to sort out her makeup or what have you, so that she doesn't make that same mistake again.